Hi guys, today we'll be talking about fifth disease. It was fifth in a list of historical classifications of common skin rash illnesses in children, medically referred to as erythema infectiosum. It is more common in children between 5 to 14 years old and can break out quickly in schools during the winter and spring. Approximately 15% of preschool children, 50% of adults, and 85% of elderly have fifth. It's a mild viral illness that is caused by human parvovirus B19. It is very easily spread through touch, sinus discharge, the sharing of utensils, or by coming in contact with blood of the infected person. Humans cannot get sick from household pets that have parvovirus and vice versa. Up to 60% of the population is seropositive for anti-human PVB19 IgG by 20 years. Adults may be infected if they don't have prior immunity. It is more common in adult women than in men. It may also be spread through blood. For example, a pregnant woman may pass it to a fetus, and this may lead to miscarriage, especially in later months. About 30% of school teachers, daycare workers, and mothers of young children are exposed to the. The incubation period is usually 7 to 10 years, and children are very contagious at this point. Early symptoms include headache 20%, runny nose 10%, mild fever 20%, sore throat 15%, nausea 10%, fatigue 15%. This is followed by a red rash on the face known as slab cheek disease. A few days later, the rash spreads down to the trunk 55%, arms 45%, and legs 9%. Adults, 20% of infected adults do not have symptoms. The main symptom they usually experience is joint pain and usually don't develop skin rash. The joint pain can last for several weeks and it's more prominent in the wrist, ankles, and the knees. Symptoms can be more severe and potentially dangerous in pregnant women. 30 to 50% of pregnant women are not immune, and direct transmission of the virus is common following maternal. The virus usually clears up on its own, but pain relievers may help with symptoms. Acetaminophen or ibuprofen for fever, topical anesthetic or antihistamine for itching, intravenous immunoglobulin in chronic parvovirus. Severe cases may require blood transfusion. Vaccination is not yet available. Normally, lab studies are now not done because it resolves in 5 to 7. Many cases of this disease go away on their own without medical intervention. It is recommended to treat fever with less expensive antipyretics such as acetaminophen or ibuprofen. Non-steroidal anti-inflammatory medications can be used as analgesics to treat any pain, as well as decreasing fever and inflammation. Over-the-counter topical antihistamines to apply to affected areas can be used to counteract any further inflammation. Patients with severe hemolytic anemia or women who are pregnant and develop the disease are required to use more expensive methods. Often they must undergo immediate blood transfusions. A patient who is diagnosed and immunocompromised may undergo fluid and IgG antibody replacement. General practitioner examine the severity of the symptoms and the extent of the disease as well as the overall health and history of the patient. And also the general practitioner role also is to prescribe and recommend medication and they encourage the patient to rest. Blood tests, ultrasounds can be done to confirm the presence of the virus, and the general practitioner aims to reduce the severity of the symptoms since there is currently no cure for viral fifth disease. Obstetricians, gynecologists provide special care to children who may have sickle cell anemia and showing severe symptoms. Gynecologists perform blood tests and ultrasound scan to confirm the presence of the IgM antibodies. Blood transfusion may be administered to the patient to protect the home. Warning: many people with parvovirus infection show no symptoms at all. The only way to know if a person has parvovirus B19 infection is to test for it. Most doctors advise their patients to wait out the symptoms because currently there's no medication that will shorten the course of the disease. If you have a weakened immune system, you should seek medical care, and your doctor may need to closely monitor you until the symptoms disappear. If your symptoms persist or worsen after treatment, please see your doctor immediately. Thank you for listening.